My name is Mugure. I'm the Research Education Fellow. I've done qualitative and quantitative research, and I teach on REDCap in CAHS. So most of the workshops that you see run here is what I've been teaching. Today we'll be talking about data collection and management. I'd like to begin by acknowledging the Aboriginal people of the many traditional lands and the language groups of Western Australia, and also to acknowledge the wisdom of the Aboriginal elders, both past and present, and pay my respects to the Aboriginal communities of today. Some of you are new here, and just in case you are, we run about 25 seminars over the year, just trying to capture various research topics and give an overview in an hour. You get a handout that has got more detailed information, so you can link on that and get the links that we're talking about and maybe some more detailed information to help you pick up on research. Then we have people joining us online on Teams and Avaya. So for their purpose, we ask that you will hold any questions that you have to the end. And if you have to ask a question in the room, please use the microphone so that they can be able to hear. So I'll just begin by giving some definitions. We'll talk a little bit about quality data, and then the processes of data collection, management, and how to develop a database. I know when we think of data, we think of numbers and text ordinarily, but when we talk about research data collection and management, it's all the information that is collected, observed, or created during a study. If you're doing qualitative research, you may conduct interviews that may be video recorded, so that video will be part of the data that you need to put in your data management plan. Or you could have transcripts, you have audio recordings. I found this old tape recorder. The cursor doesn't show, but the third picture on the second picture on the second row. Those of us who were born in the age of cassette recorders, we remember what it meant to record this tape, and you had to rewind. We used to use even biros sometimes to rewind when there was no power on the radio, but nowadays everything is digital. If you're doing an interview and you're recording it, you probably have a digital tape recorder. But that data, whether it's stored on a disk or it was stored on a cassette, that's part of the data that we have to manage. If you're doing field notes, maybe you're conducting interviews out in the field and you're writing down something, that notebook is part of the data that you must manage. Maybe you're doing experimental research and you have blood samples or histology that you're collecting. That's part of the data that you must manage and you must account for in how you're going to store it and how you're going to archive it. Same thing with photographs. So just remember that it goes beyond the text and the numbers in a spreadsheet, but to all those other information that we collect. The 2016 FAIR principles that basically looked at scientific data management and stewardship said that data needs to be fair. The F is for findable, meaning that it must be indexed somewhere and it has to have the same persistent identifier. Mostly it's a digital object identifier, the DOI that you see in journals, but this applies for all data, so that's what makes it findable. Then once you find it, you must be able to retrieve it, meaning that it's accessible, meaning that it's made open in a standardized protocol that anybody can be able to access it. However, there are areas where you may be collecting sensitive data, private data. This doesn't have to be open, but as a researcher, you have to be transparent about it and say that I was collecting information about mental health or sexual abuse, and this information must be anonymized. So for purposes of this publication, that data will not be available for other researchers to view or to make inferences from. So as long as you're clear about it, then that's okay. Then it must be interoperable, meaning that it follows the common metadata standards. And we'll see later what metadata is, which is just data about data. But it means that it's in a format that is acceptable by the research community as a whole. And then finally, it should be reusable. And when it's reused by another person, it should not lose its initial richness. So when you think about your data, does it meet those 4 criteria? Is it fair? And the other definition that we wanted to make is of the data management processes. This begins from collecting the data, how we organize it, where do we store it? And storage is beyond your USB or your database electronic software that you're going to use. What about version control? How many times do we take that into consideration? Who has access? What about the backup plan? So those are the things that we need to look at. Then when you get to share, how do you make it safe for sharing? What do you share? When do you archive the data? When do you dispose it? Do you dispose all the data? So that's the what about it. So the why is because we want to get quality data. And first reason is that it's one of the pillars of clinical trial transparency. Beyond registering your trial and sharing the results and dissemination by publication, an important pillar is that this data must be availed, the source data itself must be availed, and study documents should be available to bona fide researchers. So that's an important reason why we have to have a good data management plan. If we want to think about the policies and the legal way, it's part of what the guidelines form in Australia, especially based on the code. Anyone conducting research in Australia has heard about the code. If not, I've put a link there and you can read about it, which is from the NHMRC that basically has the responsibilities for institutions conducting research and for the researchers themselves. Your own institution may have its own policies, whether it's a university, it may have its own data management policies. If it's a research institution, the Department of Health has its own policies, and I've linked that there that you could pay attention to if that is your employer. The funder that you have or whoever is sponsoring your research could have recommendations or policies that require a good data management plan. For example, the Australian Research Council says that anybody who's applying for their funding or a grant must cite how they're going to manage their data. The same thing with the NHMRC grants, like you have to have a solid data management plan. It's now also become commonplace for journals to ask for your data management plan once they accept your manuscript. So you could be asked for your actual data, your source data, and your metadata. So it is an important thing. And I also linked a few more policies and codes so that you can know where all this legislature came from, and you can link on them at the hyperlink at the bottom. So just as a by the way, your institution has got a responsibility to train researchers. CAHS is doing this now, and we welcome all those who are not in CAHS, but we are still Department of Health, and we are still all in Western Australia. So it has a mandate to train researchers on how to manage data. Also about ownership. Who owns the data that you're conducting, that you're getting from your research? Is it the institution? Is it the pharmaceutical company? Is it the individual? Because then that will affect how the data is controlled. And this will vary based on the institutions as well. And then about storage, where do you store it? So the Department of Health has really been pushing for REDCap as the software for electronic data management. Why? They are able to store whatever information we collect on their servers. So these are secure. They can vouch for confidentiality, for the safety, for the security, for backup. So that's one of the institutional responsibilities, that whatever it's providing, then it's going to give us these auxiliary measures of security and storage. We will have to follow the policies that they have on disposal and retention. And then if data needs to be accessed by a third party, your institution has got policies about it. If the journal wants this data or another researcher wants to pull the data for meta-analysis or something, like the institution has got that policy on how to go about that. For you as a researcher, then it's important to have a data management plan from the moment you begin to write your protocol, which will probably have the policies that are guiding you. If it's your university or the HSP that employs you, then you'll mention a bit about security. Yes, the institution has got its role, but if I've got access to REDCap, how do I ensure that only my research team members have access to this project? So I must lay out what security measures I have in place. What are the licensing agreements that are required between the funder, between collaborating institutions? How are you going to train your team members? How long will it take? How will you know that they are adequately trained? Then what's your data collection tool? We focus a lot on that and we forget about the processes around it, but this is an important thing. And then what are your plans for disseminating this research? Because we said for clinical trial transparency, one of the things that we must do is to share the findings of our research. A lot of legal jargon, but how does it benefit me as a researcher? Because I think more motivation comes from what is it doing for me. If I've got a good data management system, then I can access my data easily. It saves me time because then I don't duplicate things that have been done or that I may have already done. And also it can allow for meta-analysis. If I know my sample size is small because of the region that I'm in, but I do a good work, then somebody else in a center that has got more cases, a higher caseload, then we can pull the data together and it can form for a good meta-analysis. So that's a good thing. The only thing to remember is that the raw data in itself can be misleading in terms for sharing. We can just see the results, but when researchers are coming to pull together research or to aggregate data for meta-analysis, sometimes to fully understand it, they require the source data. So your case report forms, your data collection tools, your protocols, the analysis plans, all this may be required to help with the meta-analysis process. So it's good to keep them and keep them well. So we've talked about the what and the why of data management. So I'll go a bit into the how. And for data collection, it all begins at planning. I like what Abraham Lincoln says, ask me to chop down a tree and I'll spend about 6 hours sharpening the axe. Like, you take your time in planning so that you can have a smooth process, not that you're somewhere at analysis and then you remember, I should have collected this information. So all this begins with a research data management plan. This is versatile and it's going to change as you go along. But if you think about it, if someone joins midway in the project, you could have a new research nurse or a new clinical research fellow joining in, then they can be able to pick up because they can see how the data has evolved over the duration of the study. Most of the research data management plans are institutional based. I did look up if we have one at CAHS. I didn't find one, or for the Department of Health, but I found these ones by the Australian Research Data Commons, which you can see basically that just shows you how they are managing their data, and also one from the Western Sydney Local Health District. If you scroll down, because it's a PDF that is downloadable, but if you scroll down, it doesn't have an actual link, you have to scroll down the page. But if you look at it, it actually has a nice table that tells you all the things that you should have on your checklist, which I'm just going to define in the next slide. You define your type of data. Is it numerical? Is it qualitative? Is it categorical data? And then who owns the data? What is the intellectual property rights around this? How are your files organized in terms of names, in terms of folders, in terms of versions? What's the metadata and how are you going to make this metadata? How will you store it? When will you back up? Who archives it? Where is it archived? Is it ever disposed? And things about security and sharing, and also about the budget. So if you take a look at one of those links, you'll be able to see, and it can help guide you when you begin your project, plan how you're going to manage your data. Also, from the onset, you have to think about ownership. Who is going to own this data? Who can publish the findings? If I changed my occupation today and moved to another HSP, and we were studying diabetes in adolescents in PCH and other hospitals, do I go with the data because I was the PI? What happens? So this must be very clear as part of your research data management plan. Because those things happen, life happens, people sometimes move, relocate, or drop out of the study for one reason or another. So this must be very clear. And the Department of Health has got guidelines about intellectual property for research that occurs in Western Australia under the Department of Health. So once you plan, then you think about your data collection, and this will be determined by your research objectives. If you want to test a hypothesis or maybe measure an occurrence or get some statistical insights, then you're moving towards a quantitative kind of data collection. But if you want in-depth analysis of ideas, get what people feel, their experiences, then you want to go qualitative. But sometimes we quantify qualitative data. Common example is when you want to ask for a pain score in a patient, you give a visual analog score. But how do you analyze that data? You put it in a numerical format. You say on a scale of 0 to 10 or something, like you quantify the qualitative data. So you're getting their experience, but you quantify it. But all this is important for you to know how you're going to collect your data. So based on your research objectives, determine if it's qualitative, if it's quantitative, or you're quantifying qualitative data. You can't think of data collection without thinking about consent forms, because we are dealing with human data. And your consent forms must have something about storage. Your patient must know where you're going to put this data, who will have access to it, and how will it be anonymized, because sometimes they give information that is very private, and you must identify in your consent form how you will de-identify that data, that it will never be linked to the participant again. Then how are you planning on using your data? This makes for quite a long read, but it's important because it's part of the ethical process of getting your research going. So do you plan on sharing your data? When you do your manuscript or when you publish your manuscript, how do you make sure that in that sharing, the patient remains anonymous? And then there's always the bit about future research. One of the things about data collection is that we can collect secondary data and use it for current research. Think about all the things that happened with COVID. They happened at a go and studies were done ab initio. Maybe we were testing the efficacy of the vaccines during the Delta wave. But then 10 years down the line, we could find out something new and we want to plug into that data. So you don't want to have to start looking for those patients who are part of that randomized control trial. You can cover this in your consent form by asking if they agree for their data to be used for future research or to be contacted in case of future research regarding the thing. Then also think about your methods of data collection. If you're doing qualitative research, are you going to have open-ended surveys? Are they going to be handed out electronically or paper format? How are you going to store them? And how are you going to enter that data? Or are they interviews or focus group discussions? This is important because we always go back to secondary data for future research, so you must be able to keep it well. For the quantitative data, is it through experiments? So you'll be measuring something in the lab or an intervention and seeing what the outcome is. Is there a validated tool that you're using to measure the outcome? Or are you using a closed-ended survey? Is it something you're observing and just documenting? So do you require a spreadsheet or do you require something more complex, a database of sorts? So think about what you want based on your research objectives, and it will determine the methods of data collection. If you go the quantitative way, then you'll have variables, and these variables affect how you collect your data. Categorical data is data that is categorized, put in groups. If it is something that is definite, like names, gender, it is named, that is nominal. But if it is ordinal, it's something that can be ranked. You want to stage cancer and give it a stage 1 to 4, so something that can be ranked. As compared to numerical data, which can either be discrete, meaning I've got 5 children, I can't have 4.5 children. But if it's something like the height, it can be 150.5, meaning it's continuous. So think about your variables because it will determine how you set up your database. All these things eventually tie up so that you can know how to set up your database and reduce errors. Then once you figure that out, what are your data collection procedures? The main methodological issue that will influence any generalizability of clinical research findings is how we sample. Because we can collect data from everyone in this room, but we'll find that we have common things, and so we'll be biased towards maybe one occupation, maybe a particular level of education. But if we do some sort of random sampling, then it means our results can be generalizable. In this day and age, we are doing sampling using computer-generated programs. So once you do that, that must form part of your research data, part of what you're going to put in your storage or in your archiving, part of what you're going to submit to the journal or to your funder for the grant. So that sampling technique and your recruitment strategy must form part of your data, your research data. Goes without saying your data collection tool, whether it's a simple tally with sticks and crosses, or you're going to do more complex kind of tallying, that's your data collection tool. We'll go more into the storage. How are you going to train your team members? And at what point will you know that they are adequately trained? And what are your quality assurance protocols? I must say, pilot. I've had this problem when teaching on REDCap. So we design the researcher designs a tool and then activates it for data collection. And then later on realizes that they had an error. Now making that change becomes difficult because you already have a subset that you have collected with this particular variable, then you go around and change it. It will be a nightmare for the person doing analysis, okay? So think about it, pilot. When you think you're done, give it to somebody else, get a fresh set of eyes and see what they think about it. And then another thing is collect only what you need. If I'm looking at the prevalence of a disease, maybe I may get it according to the different states in Australia. But somebody else who's doing social work and looking at an impact on maybe a behavior may require something about the suburbs. So I can collect your area of residence as simply being a state, but somebody else who's doing social work, their research targets social work, may collect the suburb. I don't require to know your street name and suburb. All I require to know is where you come from. It may even be the continent that you come from. Then everything should have a unique identifier. Sometimes you collect data in different tables or in different forms. So how are all these things linked together? Your unique identifier is not the patient hospital number. It's a unique research identifier. So this is what links everything together, and we'll see that as we talk about databases. Another thing is to collect data as a continuous variable and then categorize it during analysis. Common thing is to collect age in age groups, and then let's say you are doing a prevalence study of a disease. Let me use cancer in the young. So at what point do you know that this young patient is actually young? Because if you've grouped them maybe 15 to 40, and then 40 to 60, 60 to 75, but then it could be hitting under 30, or it could be the 50 to 60. So it's easier for you to collect, or it's more, for more valid results, collect the age as a continuous variable, and then categorize it later, that you can say for grouping, this was the distribution among these age groups, but I found that the mean age of this disease was 40 years old, and the percentage of the population that had this disease that was aged under 40 was 35%. So that is a matter of national concern. So deal with it as a continuous variable and then categorize during the analysis. I can't overemphasize the need to test and test and test before you begin data collection. Then you need to consider if you're going to use a hard copy or an electronic format. Of course, I'm going to promote REDCap and let you know we have our last 3 training workshops for the year, but don't worry, they're accessible online in case you don't get a slot. But it's free, it's user-friendly, and I've put a link to how you can get your REDCap account from the Department of Health and also our REDCap resources. So you're welcome for any of our workshops that will be held next month and in September as well. Then you can also have a hybrid way. Maybe you are collecting data on a hard copy, then you want to put it into your electronic software. Do you scan it, or do you have research assistants who are going to manually enter the data for you? Because you must understand not all populations are going to have access to technology. So we may want to use electronic, but we cannot be fully electronic because of the research population that we are targeting. So you've planned and you've collected your data. Then you realize that data can be messy. My understanding of something could be different from another research team member. So I may have been asking the country of origin. One person writes United States of America, another one writes US, another one writes the US. You know, like it could have different formulations. So it can be very messy. It could be inconsistent. It could be incomplete. Maybe I started writing the United States, or I just wrote the United, so is it United Kingdom, is it United States of America? It could be misspelled. So if you're just going to use a spreadsheet to sort of like sort your data, then the phrase that you put in the terms in the search string or the sorting string is not going to be able to get all the data about people whose origin is in the United States. So you could have data that is inconsistent. And anytime you have inaccurate or invalid data, then you have a risk of getting errors. With errors, you get a false positive or a false negative result. So data cleaning is important. Now, contrary to most of the beliefs, data cleaning takes time. You may have a subset of only 100 patients, but ask anybody who's actually had to do the nitty-gritty of data analysis. The collection is a breeze. The cleaning makes you want to pluck out your nails because of all the inconsistencies. And that's why we'll look into our database development to see how we can help to avoid some of these things so that to make the cleaning process a little bit smoother. You want clean data because it will be valid. Valid results are generalizable results. If they are accurate, they're complete, they're consistent. You don't want to have the same entries because you have multiple entries that could change your mean. It could change your measures of central tendency. So you want to take time with data cleaning. I like to simplify life. I have learned from the men in my life. Men love to simplify things. You will waste time washing dishes, they'll put them in the dishwasher. They probably bought their washing machine before they bought the couch. Like, men like to simplify things. So software is available. You can use statistical software if you're using SPSS or R or Python. But if not, you can also use OpenRefine, which is open source provided by Google. And there are tutorials on how to use this to help you to clean your data. What you must remember is to back up your original data set so that you can preserve it. Then now you begin the cleaning process. And this cleaning process cannot be discussed in 2-3 minutes. It's a bit more intensive, but I'll just say that you keep a permanent record of this cleaning process. It even may have a couple of versions because the cleaning process may take time. But you must keep a written record of it. It's a permanent record that will be saved as a read-only file, which is basically a command file in the different software. They'll have different names. It may be a syntax file in SPSS. OpenRefine will call it something else. But this is a file that cannot be altered, and it shows the processes that took place. Document each step. And what are the steps then in data cleaning? The first is validate your data. This is simple because if I wanted all my dates in the format that we use in Australia, then I'll put maybe date, month, year. Did I tell you we can simplify from the beginning? A good software should be able to validate for you before you get to this process. But in the event that you don't, you can still validate it at this point by saying this is the format that I require. Then screen your data. Screen it for inconsistent data. Inconsistent can be, is it invalid, is it missing, is it something that is in the extremes of your distribution? And this can either be manual or using software. Of course, we'll go for the software route, but if you have a small data set, feel free to go manually and just learn the process. Then diagnose what the issues are. One could be duplicate data. So duplicate makes sense. You have one entry of the same person, 2 entries of the same participant. So they're identical copies of the same data, but you only need one. The other one could be invalid data, like we said, maybe the date is in a different format, or age is written, some in numerical, others in text. Maybe some people have written 10.5 years, or if you're a mother, 24 months and 36 months instead of age in years. So you sort of have to put it all in the same format. That's standardization. Then the missing data. There are instances where you can validly have missing data. For example, if I had skip questions. In women, I want to find out if they're breastfeeding or they're pregnant. I can't ask that question to men. So it's valid that if a man answered that survey, that question about pregnancy and breastfeeding will be blank for him. Now that's a valid missing data. But there are other times that data is missing because of a random cause or a systemic cause. Maybe it was during data entry that someone missed, or somebody misread a measure. They wrote down the age, they didn't write down the measurement at all, or maybe it was the question was badly designed, so the person didn't answer it, and we cover how to define your survey questions in the previous survey workshop. So there could be different reasons why this data is missing, but you must be able to identify that it's missing. Some of this software will allow you to give a code for genuinely missing data, and others, you will have to generate that code and say, for any data that's missing, we'll code it 9 or something. Then outliers, again, we said those are the extremes. So having diagnosed these issues, you come to correct them. Deduplication is easy. Sorry. For duplicate data, you want to only keep one entry. For issues with validity, the way it's standardized, you want to put one format. If age is being gotten in numbers, it's in numbers. If the date is in this format, it's in this format. But now what happens with missing data? Now, missing data has a couple of options, but that will depend on the research team and what you had agreed on before. So this is part of the research data management plan at the planning stage. So when you do that, you sort of like first tabulate your missing data and try to see, is there a trend to this missing data? And then if there is no trend, what do we do with it? Is it a few of the records that are missing data, or is it majority of them? If it's a few, can we delete them? Or can we infer that maybe we can put in the mean or the mode or the median, or we can use some of the processes or predictive models to be able to get the value. So there's a lot you can do with missing data, and this must be determined with your data management plan. Same thing with outliers. You'll probably notice outliers because you've seen them on a scatter plot or a box plot or your histogram. So are they real outliers? Was it an issue with data entry, like someone put the age as 1,000? Or was it an actual correct data entry and this is a real value? So how are you going to deal with those outliers? And there are almost 6 to 7 steps of how you can deal with that, which we can't cover all at this point. But just know that there are options to deal with it, but they must be determined in a way that's not going to affect your results or to affect it in the least possible way. Then you export it to your statistical analysis software, and the process continues. So we've talked about the what of data management and the why. We've talked about data collection, and the processes entail analysis and cleaning. So then how do we manage all this data? Last week, Ali gave a nice talk on the introduction to good clinical practice. In case you didn't watch it, the link will be available soon. But you can also do a course online for about 6 to 8 hours that you can do at your own pace and learn about good clinical practice in Australia. It just gives a good overview of what your requirements are in terms of data collection and management, and also how you'll handle yourself as a researcher. So we've collected the data. Who has ever been guilty of this? So this was me writing my dissertation. It wasn't on this, but just trying to tell you. I initially began with protocol draft, and then there was draft 2, draft 3. Soon there was final draft, draft before review. Like there's no method to the madness. Like it was just complicated. You will have 20 million drafts, yeah? And many of us are guilty of this, but there is a proper way that you can name your file. You want consistency. If I, as a research team member, are entering data and Karen as well is entering, it needs to be in the same format. Meaning the elements need to be aligned in the same way. Are we going to have a date to it? Are we going to name the content? Does our project have a name? It doesn't always have to have a name, but maybe you're doing an Aspire project, or the project has a fancy name, so you can put the name there, and then your initials so that it can be identified to who created this file. So what's the order of those elements? How are you going to have it as one long word, or are you going to have spaces in between? If you'll have spaces in between, some software may not read the spaces, so the recommendation is that you use a hyphen or an underscore so that it can be compatible with those. And then what keywords? If I call something a survey, you as my team member need to call it a survey. So we must agree that it's going to be a survey, not a questionnaire. So we have the same things, like there are things that could be medically or clinically have the same term. So agree on the keywords, and these keywords remain the same. So like in this example, we decide that we are going to sort our files by chronological order. So in that instance, probably the date comes first. And that is how we chose to structure it. So the date, and then an underscore, and the date is in a particular format. So all this is written in your data management plan. Your research data management plan must have how you're going to name the files, so that even if somebody new comes in midway, they know this is how we name the files. They can read through that summary and know that if I'm storing any data here, this is how I'm going to name it. So I have the date, an underscore, the content, and then my project name, my initials, and then now the format in which it's being stored, whether it's a spreadsheet, whether it's CSV, whether it's audio, whatever it is. So they should all be named the same. Having done that, how do you then organize all these files? A good tip is to make a copy before you make any edits. Yeah, if you're doing any version control, have the original one so that you can keep it as version 1, and then you have version 2 or subsequently. Don't complicate it too much. Let it be intuitive, something that anybody can pick out. We have a lot of data as the research education program, but anybody who joins in can be able to see that this is about seminars, this is about workshops, like it's literally intuitive. This is the master file, this is for analysis, this is the backup. And then now you can go further ahead and break down into different folders within the different directory levels. Sorry. The thing we forget also is to save in a format that can be accessible in the future. If you're born in the 80s and above, we used to save Excel spreadsheets, maybe as formats that are 1997 to 2003. Are those usable now? So things have changed, and they will change for sure in the coming years. So save it in a format that can be accessed in the future, because you're thinking about secondary data collection. You're also thinking about data sharing. So think about how this can be done. And then versioning. When you version your documents, it allows you to revert to the previous iteration when you need it. And anybody who joins can see how the data evolved. So as a team, you must have it as part of your data management plan, how many versions you'll keep. Are you going to keep all the versions? Are you going to keep all the versions after ethical approval, or what's going to happen? Makes sense to keep the previous versions in the same location rather than have different folders with different versions, because then you could end up duplicating work, or in different spaces. So you have one on OneDrive, another one on W Drive. So kind of have the different versions in one place so that you can be able to avoid duplicating work. As always, there's a way to help. There's software that can help in versioning. Yours may be a small project, cross-sectional within one hospital. Somebody else could be running a massive clinical trial in 6 sites. They'll have different versions. They'll have maybe HRECs between institutions that are under the NMA agreement and others that are universities. So there'll be different formats of doing things and different versions. So maybe the software would help. And JIT is a good one that's easy to use and intuitive, and you can look through it and see what fits you. But you can also simply have a version control template. Again, I looked up what we have. In Western Australia, the Record Management Advice has one that I've put a link to. But I also found a good one in the University of Sydney Library, and that's what is displayed on the screen, which is very simple. It's just a table that has got the title, description, who created it, when it was modified, the modifications made, and the status. Basically, you need to keep track of your versions because you will forget how many you have. And you do this as you go along. Every time you get a new version, then you document it. You have a good versioning platform. So your data management also involves metadata. Think about it as a note to your future self that will remind you why you did what you did. Or anyone else who's accessing your data, how can they find it? Metadata is, you see it all the time on your Windows computer, for instance, or even your Apple. It will have the file name and date last modified, the size and what have you. Like, it's got information about that data. That's what metadata is. But now for the purpose of research, it may be embedded within the data or it may be separate. You'll find that for publishing or for policy grants purposes, you may require to have a metadata as a separate instrument. So do this as you go along. Every time you require something about that data, note it down, write it as you go along, and then you store it in a plain text file, which is your README file. Or some universities, I'm aware, have got an e-notebook, which is virtual, and you can do this on the move. So metadata is, think about the future. How can somebody access it? One of the common metadata schemes used is the Dublin Core. And when you look at it, it's actually stuff that you'd want to know about that data. What's the title? Who created it? What date? What's the format? What are the rights? What's the type of this data? In what language is it? So you can have elements of this, or you can have the entire schema, but it depends on what your data management plan is. Having done that, we store the data. Storage has to do with access. And when you think of access, think about the people that you're sharing with. If I've got collaborators at Fiona Stanley and maybe Armadale, how are we going to, am I going to email them the forms, like the data set? Or are they going to have a USB stick that I take physically there? Or do I have a software that can allow us to all access that? And then if we're collecting data from different sites, do I want the data for PCH to be accessible to the guys from Fiona Stanley? Or can I have a data access group that limits only the researchers in PCH to see the data for PCH, and those for Fiona Stanley to see for Fiona Stanley. So REDCap helps with that, just as a by the way, in case you are looking for a software. But you must think about how you're going to share and with the supervisors and the people you're collaborating with. Then where is this data actually stored? Some of the things we use for surveys, do we know where they're stored? Yes, it's on the cloud, but where are they? Who owns this data? What law governs it? Is it the American law or is it the Australian law? When you think about SurveyMonkey, when you think about Dropbox, these are all American things, and the law that governs them is very different from what is there in Australia. So it will give you problems with your ethics committee in trying to justify why you're using that for your storage. What happens if a third party that's storing your data goes under? What happens to your data? What's the security around it? So that's why this software that's been fronted by the Department of Health that is on their servers is quite secure. I'll sing REDCap one more time, but it's quite secure because you know it's owned by the government, it's owned by the Department of Health. Then your storage must also think about backup. It's automated best, but if not, are you going to also do something else? Yes, the Department of Health will have a backup, but will I have my own personal backup as the PI of this study? Probably advisable, right? Things always happen during a change or an upgrade in the software. And then also think about your data repository. Where is it stored for archiving? With storage, you must think about retention. In Australia, for adult research, it's kept for a minimum of 5 years. In pediatrics, until the child turns 25 or 5 years after the last reference. But there are exceptions. Maybe you may need to keep permanently if it was gene therapy research, because this is not widely done. Things that are of international or national significance, a lot of the COVID data is going to be kept permanently because this is a new disease by the time we make sense out of it. Maybe studies that are impossible as well to repeat. If we took efficacy of Moderna vaccine during Delta wave, it will be difficult to repeat that unless we have another Delta wave, so those may be kept. Then when you think about your sharing and publication, your dissemination, probably what's important is the licensing. Others can view and then reuse your data, but they must be able to cite you. And like mentioned earlier, some journals will require that you publish your metadata along the dataset once they accept your manuscript, because people can be able to go through. So this data must always have a DOI, a digital object identifier, and you as a researcher, your persistent identifier will be your ORCID ID. Anytime someone wants to read up about colorectal cancer in Kenya, they look up my ORCID ID and they'll be able to see that. I'm just giving an example. So people associate you with your research, but not always your name. Your ORCID ID will be the persistent thing. Yeah. Then something on the database development, because we've been picking up on things that will help us create our database, which is basically just an electronic filing system that we use for data entry, for storage and manipulation. As you've seen in most, if you think of your spreadsheet, the rows are the records and the variables are stored in columns. And your database can either be relational or a non-relational database. What you want from a good database is that multiple users can enter data at the same time, or somebody can enter from different sites at the same time, and different people from different sites at the same time. And you also want to have good data integrity before analysis. Like I said, you can end up cleaning data, or you can fashion your database to have that validity before the data entry begins. That's a list of software that's available for database use. And I've circled REDCap because it's what the Department of Health pushes. Your university could have something different, or your research institution, but it's free. Local storage, the Data Library Department of Health is in charge of that. It has web access. You can also access it offline in areas where you don't have research. You can have validated tools that you can actually upload and use. You can create reports. You have a front-end check where you can say all the date must be entered in this particular format. I'll only accept an age between 0 and 18. You can place those checks and balances, and multiple users can use at the same time. So as a researcher, it's up to you to be able to see what you require and what works best for you. Whatever the case, a database will always have a data dictionary, which basically has your variables and descriptions about them. If you have validated these variables, like you have said the date will be in this format, or the phone numbers that I'm only accepting are Australian format, then it will have that validation. If you've coded, for instance, on REDCap, if you have a multiple choice question, instead of REDCap storing this as A, yes, B, no, it stores it in numerical format. So yes will be 1, no will be 2, etc. Or 0, 1, 2, and the likes. So that's the coding that is there for that database. So what's the code for your database? That's what is held in the data dictionary. And it will also give you the range of continuous data. Like I said, you may not want to go through the process of identifying an outlier whose age is 1,000 years. You could preempt this by specifying this in your data dictionary, that I'm only capturing ages between 0 and 18. So if someone puts in an age more than that, the system pops up an error message and tells them that the age that you've entered is outside the range for this study. So that will help prevent errors with data entry. You also have different tables. Maybe you have one where you've collected the demographics, another one where you've collected like vital signs, another one where you've collected the mental health parameters. How do you link all these tables to this one particular person in that database? And then how does this relate with other databases? So your data dictionary will be dynamic. I just gave an example that I borrowed from Professor Suskal, and this one was clinical observation starting from when the child was admitted, and then you can see the different definitions. The study ID has been defined as a number with those values. If you look at the observation time, it's given as a number and divided into various codes, that there's a baseline hospital data at the point of enrollment, and then the 12-hourly obs. So every time data is entered and they select the time, then it will be coded as per either 1, 2, 3. And then the temperature, the data type will be a number, the date will be a date. So basically your data dictionary is very descriptive of your variables. Not your data, but of your variables, so that it gives all the validations and descriptions about your data. Unique identifiers is what links everything in your database. They are record specific, and to repeat, it's not the hospital number. You can either automate it or have it manual. If you're having multiple people enter data at the same time, probably want to automate it. That way nobody has to think about the manual number. Before, when we were just doing hard copies, we'd probably write them all out before or go writing as we are recruiting people. But now with all these other modes of collaboration, then you can just automate the process. And it's what will link the data between databases. Now, variable naming is different from your file naming. If you've ever seen a spreadsheet, it can run up to how many columns? More than 20 columns. So because the column headers are the variable names, you want something that's unique but intuitive, something that you can reach out. If I see DOB, I think date of birth. It's short, it's informative. I don't have to write the whole term date of birth because my column becomes wider. That means I get more in my spreadsheet. It just becomes very difficult to be able to just look at that data. And then how will you name your variables? Some of the software, again, declines spaces and punctuation marks, so you may have to use an underscore or a hyphen. And make sure that as you name your variables, they're compatible with the data entry and statistical software that you'll use. Then we've got the other thing to think about when creating your database is the type of data that you're having. We've already talked about it in the data collection, but then it will help you know how you're going to create your database. Are you going to collect numerical data in the same way as categorical data, or are you going to code it different or design it different? Again, it helps you to validate data where applicable. Do you want your research assistant to be calculating the age, or can they simply write date of birth and the date of enrollment and the program calculates the age? Or the BMI or the Alvarado score or whatever it is. Like, you want the computer to work for you. Let the software do the work for you. So basically, in designing your database, write down the base things that you require and put in the formula required for it to do the work in the background, so that the person collecting data is simply just writing the things that are intuitive, that are collected in the clinical setup. And then what will your code be for missing data? So the two databases that we have is a relational and a non-relational database. And if you look at this one, We've got a table that looks at the general details, and then the examination, and then the swab details. But you notice that they're all linked by one thing, which is the ID. That's the unique identifier. And it can be, REDCap auto-generates this for you. Other software, you may have to key in what it is that you want in terms of your record ID. But just look at that when you're choosing a database software. What does it do for you? That's a relational that you can link this table to this table to this table and any other table that comes. But then you come across this one where there's an ID, yes, but you can't really link the data between the two. So this is ID 1, Joe Blogs with double G, and this one is a single G. And then, fine, we've got the same exam date. Then comes the second table. There's this exam date, penicillin given, and then the same, but a different, like it's very disjointed. So you want things that make sense for you. So when even teaching about this software, one of the things you must learn is when it generates the record ID for you, where does it store it? Because that is something you must never delete. If you lose that, you easily move from order to chaos. And when you come to analyze your data, you'll realize you can't actually link who is who. Yeah? So make sure that your software protects against that. You want to minimize errors in your database by, let me remove that laser, by ensuring that you check that compulsory fields have data put in them and that you validate data. If you're required to put branching logic or a skip, it means that if you answer yes to this question, go to question 25. If you answer no, proceed to the next question. So that's what you want to try and minimize, and it takes time in setting that up. Then test your database. That means duplicate a record, see what happens. Does it pick it up? Check your branching logic. If I click yes, does it take me to question 25 or does it take me to the next question, number 3? The compulsory fields that I require, if I don't put data in them, what happens? Does it give me an alert? What if I put a number that's out of the range that I have put in? What does the database do? Does it? So you must test and test and test before you actually begin your data collection. So test your database, see what happens, and check the error messages. And then finally, what's your role as a database manager? Because some of you are not only researchers, but you're managing the research project. You're doing the clinical bit, but you're also doing the research project. And you're managing that database, so you're setting up a database of patients in your locality. You must fine-tune the data collection form because you know what output you want. People can come and give you whatever data collection tool it is that they want, but if you notice that the variables being collected are going to give you problems in analysis, you have the right to say this is not the right way to do it. Design your database and create the data dictionary so that anyone can keep track of what is happening. Query your database regularly and get reports. Like when you test, you keep checking the validity. REDCap has got features where you can do this, run like some sort of quality checks, and it can give you a log check where maybe the calculations may be wrong. That's good for quality assurance, which is an important role as a database manager. Also, to determine who can access, like we said, you have data access groups. It's collaborative, but not all the people get access to all the data. And then advice on data cleaning. So quite a lot. Just like to acknowledge some of the slides from Professor Skull, and I'll happy to take any questions if you may have regarding data collection and management.
Thank you, Jane. That was excellent. We have a couple of comments online who just say thank you for the very interesting seminar. And Ian commented especially the info on using the cloud.
Yeah. Free is not always free. It's got restrictions with it. Where is the data being stored? Yeah. Yeah.
Thank you for your interesting lecture. I have a question about data cleaning. Would you recommend sort of cleaning as you go in order to improve the tool that you're using to collect the data, or is it sort of like an endpoint thing that you would recommend?
I would say, if you think about the areas that you're going to clean, how are you collecting your data? I'm very pro planning it way in advance. Yeah? You can deal with things like data validity in how you create your data collection tool. That this must be entered in this format. You can deal with outliers by putting a range. So that is sort of like you're doing it before you even start the data collection. Then you leave the data cleaning to the end. If your data set is primarily data cleaning is done at the end of data collection, but there are instances where I, as the PI, have got multiple research assistants. So they will enter the data, but my work is to, to check that the data has been entered correctly. And software does allow you for that. So it will be marked incomplete until I verify that the data has occurred. So that is a way of cleaning while going on. It all depends on what your project is, what your data management plan is. Primarily, people clean at the end, but software does allow that you can clean as you go along, check what the missing data is, which is advantageous because if it was an issue of someone missing out to enter a date of birth or something particular, you can follow up with that person because it's usually indicated who put in this data entry. You can follow up sooner. So it's more or less on the team, but it works either way. Yeah.
Thank you.
We do have one more online here. Annie is asking, could you please advise me on the fastest method for transcribing audio recordings into written words?
I did qualitative research. The fastest way is to employ someone to do it for you or a group of people. There is software that helps. The problem is, for software to pick what was said, it has to know how you're pronouncing things. If anyone is in radiology here, at the dictaphones that they use, they sort of like train the thing to learn their voice and to learn their dialect, learn their accent. So the quickest way would be to get multiple people to do it for you. Get transcribers who are well-based at it, because I know that's a big challenge with qualitative research. The software even that does it has the limitations of the different intonations and how we pronounce words. Yeah.
Google Translate? No?
That's not transcribing. Transcribing, yeah. So it's taking the audio recording and putting it. Anyway, take home is this. Data management requires you to be meticulous, obsess about that data, be systematic and be logical. You ask the right question, you get the right answer. There's nothing that comes by chance, but it takes all attention to detail. Next week, we'll be doing rapid critical appraisal of scientific literature, so please spread the word for those who want to learn how to do that. Then I must highlight, we'll have a manuscript writing workshop on the 15th of August. That's a Tuesday. It will run from 1 to 3:30. We run that in the TKI seminar room. That's on the opposite end of this corridor. You're welcome if you're almost winding up your research and you just need some advice or you need another voice or you're stuck, you don't even know where to start, who to submit to. And I've just bombarded you with telling you that the journal will require a data management plan and you're worried I didn't have a data management plan. So you're welcome to the workshop. And then on the 18th of August, we'll have Media and Communications in Research given by Karen of Telethon Kids Institute. In your email, you'll get a feedback form, probably within a couple of minutes. Please let us know what we did well and what we could improve it. If you haven't had lunch, have a snack as you go. Thank you. Oh, and our symposium. We want abstracts if you're almost done with your research, so please sign up for the symposium. Thank you.